We are here at the Retama Hospital, University Health's one of our newest projects here in San Antonio, Texas. We're on the northeast side of town. We're doing a similar project on the south side of town. And the purpose here is to kind of relieve some of the pressures in the medical center, but also get the hospitals in the community where the people are. This will be our second and third hospitals. They will be done first part of 2027. We started these projects in design in like 2023. And through the process, and we decided that we wanted to do two projects simultaneously, we started looking at, we went to one design team and said, let's make a single plan, a prototype hospital that is the same, and that way staff can transfer back and forth and know where everything is in the building.
So some of the uniqueness of this building and having shared projects is the ability to share equipment across and equipment selections. Goes all the way down to valves and then all the way up to generators, building management systems, electrical equipment, chillers and boilers. They're all the same across both projects to ensure that training, management, and long-term utilization by the end users is known and shared. That even goes into the nursing staff, right? And clinical staff that are here. They know exactly where and how to get around this building. So you can train at one and deploy to another. That also allows for early training to happen at one facility. And then when they get here, they can ramp this project up a lot quicker because they've already been trained up at the other project. So again, huge benefit, I believe, in these twin sister projects. It's been a unique experience. I'm not sure we'll ever get to repeat it again, but if there are folks that are attempting it, I think there's a couple of key points that this project definitely has done right.
The reason for the twins was, one, a simplified design. It's faster. We actually, the BIM model that it was created in, we were actually past construction documents before we actually split the model. So we did one overall design, and then there are some differences because we're in different municipalities here, that at one point we had to split the design to make those adjustments. But we were past construction documents before we did that. So the teams had to work in unison as that as well, because things that are needed on the southern project may not be needed on the northeast project. So the teams had to know that and account for it.
While both in Bexar County, these hospitals are quite a bit of distance apart, and so they will be serving different communities. So for the Palo Alto Hospital, we used a lot of bright colors, a lot of different materials, and for the Retama Hospital, we used a lot cooler colors and then a lot more limestone and materials that are more general for this area.
We did have to approach permitting a little differently between the two projects, so there are a few differences as far as like building systems. In Selma, they considered the hospital high-rise, so we have additional life safety features to it that were not required here at Palo Alto in San Antonio. There are, on day one, there's going to be 20 more beds available at Palo Alto to help serve the need on this side of town. But they both have the same capacity for future growth, both vertically and horizontally. So each hospital can grow and change as their immediate community needs it to.
All right, we're standing here in an ICU room up on level 3 of the Retama Hospital on the northeast side of San Antonio. This room is very similar to most med-surg rooms, but has a different purpose with a higher level of care. You can see in the room we have a prefabricated toilet pod that was included on both projects.
These were manufactured by a company in Pennsylvania. Again, it was shared between both projects and the design team developing these. Completely finished, completely fitted out, just as you see them today. Fixtures, accessories, all finishes done, put on a truck, shipped in, and then flown into the building. So that saves us numerous amounts of effort and labor on site. That shifts all of that off site, much more controlled environment. And the finishes, the quality that comes out is repeatable, and we don't have to worry about fitting all that finished stuff right here at the end. They come completed, vacuum sealed up, and we open them up and they're ready to go.
We proceeded on some other items such as this head wall. Anything behind the drywall was prefabricated in a close warehouse off-site, and that was done because of the labor difference and the labor constraints that we faced with different trade partners on the Retama project.
What we're looking at here is really the back of house thoroughfare. It's a corridor that stretches from the emergency department all the way past imaging, PACU, which is your surgical recovery area, and your surgeries, your OR surgical department. So essentially what it does is it allows patients and staff to move freely behind the scenes so that they don't interact and mix with your public and your outpatients that would be coming through the front of the hospital. And then this corridor actually acts as a buffer to where in the future all these major departments are set up to where they have their own swim lane for horizontal growth as the hospital's volume increases.
We interviewed for the project amongst a variety of different competitors, and University Health said, hey, we have 2 hospitals, you'll get one of them and you're expected to work with your competition. What do you think about that? We said, hey, we embody the 6 tenets of lean, and one of those is optimize the whole. And as we optimize the whole, we mean it's not just about our project, whichever one we get awarded, it's about University Health and the University Health mission. How we can help support that, we'll come together with whoever we need to make sure that both projects are a success.
So we brought on 2 construction teams, and they work together through pre-construction all the way up to now. They sit on each other's owners' meetings, calls, they attend each other's meetings. So it's been a very unified, and in this market, we even bid all the jobs as one, and people proposed on both. But due to the labor constraints in this market, we really had to go through and say, okay, this contractor's doing this job, that contractor's doing that job. So we kind of chose the best 2 of every group, are the ones we hired. I don't think there's but about 4 or 5 that are the same on both projects. And at one point, I think we had probably over 1,000 people between the 2 jobs working at one time when we hit our peak, if not more. So you know, that's a challenge too, but a great opportunity to bring work to these communities and increase the workforce and even training of many people that will go on to further careers in the construction business. The prime subcontractors talk to each other, they get copies of each other's RFIs, so they fully understand what's happening at both projects. And my plan there was, I don't want to have to find the same error twice. So if we find something on one, share it with the other one to make sure that we're not stumbling more than once. Right now, these projects are on schedule to open, again, first part of 2027, and make sure we extend the care out to the community, and just looking to make sure that we're caring for the constituents and patients of Bexar County.